Hello doctors, so we will have our next topic as temporary acrylic partial dentures. Now we have told you in earlier times itself that a removable partial dentures can be a cast partial denture or the one with the clasp and all that we use in the daily dental colleges and schools, that is called as treatment partial denture or TPD. Or interim partial denture, that is like a temporary thing. So what is a temporary acrylic partial denture or a interim partial denture? Those dentures which are used for a short period of time prior to a definitive denture fabrication, those which are used are called interim partial denture. Now that will not have any major connector. That major connector in those kind of treatment partial denture will be made up of acrylic and not of any cast metal. And the clasp, the direct retainers, if I say, for those direct retainers will be of the wrought wire clasp. So the direct retainers will be acting as a wrought wire clasp, and we have our acrylic resin as our major connector. Indication, where all should we give that? Large pulp horns that cannot fabricate a bridge. For example, an aged patient of 15 or 16-year young patient to our clinic. Now we know that the pulp horns are very high in position and the tooth is also not evolved and formed properly. The enamel has not developed properly. Those people or those tooth, we cannot go ahead with preparing a fixed partial dentures. So for in those cases, till the waiting period, we can always give a treatment partial denture or temporary acrylic partial dentures. Clinical crown in the cases which are too short, that if we give a crown over that, a fixed partial denture over that, it will not have retention. So in those cases again we can go ahead with a removable partial denture. Where we have no usable undercut, all parallel tooth, we do not have mesiobuccal or distobuccal undercut, because if we had a mesiobuccal undercut, I would have given a wrought wire clasp. If I would have had a distobuccal undercut, I would have given a vertical projecting clasp. I do not have either of the undercuts. What should I give? Now what I will be giving is a treatment partial denture or a temporary acrylic partial denture. Now coming to the other ways, like the children who are permanent teeth who wants a solution prosthesis be grown quickly outgrown. For example, the children that have not come with a permanent teeth altogether right now, as I told you, 15 years age of patient or lesser than that, 13 to 15 years maybe. So the teeth is also yet to come and we have to use as a space maintainer maybe. So those cases also we can be using to prevent from caries, trauma, congenitally missing teeth. So those cases we can use a treatment partial denture to maintain the space. Temporary time of financial constraints. Some patients can come to you saying they do not and cannot afford for a cast partial denture or they cannot afford for a fixed partial denture. So in those cases we can always prepare a treatment partial denture, interim partial denture to those particular patients. See, for example, this patient, we had a natural teeth present and we have prepared this partial denture onto this. Now this kind of denture where we are occlusing with the natural teeth all together, all the sides, are also called QSIL dentures with a plastic gasket present, which is not there. Soft liners can be used, but this kind of dentures are called QSIL dentures. Coming to the next, also it can be where there is sudden loss of teeth. Before sufficient healing has occurred, we cannot go ahead with the final fabrication of prosthesis, may it be fixed or removable. Till that particular time, again interim prosthesis is coming into picture. Accidents after extraction. After extraction there is another accident. So healing period is again increased. So we cannot give away or start away with our removable or a fixed denture prosthesis. So in those cases we can give interim prosthesis till the healing period is complete. So it can also be acting as a transitional denture from the old denture that we are giving immediately to that of a new denture, that period of time, transitional denture. Like for this case, this patient was a mentally ill retarded patient coming from the mental asylum. After 10 years, his child got into the clinic. Now, if I would have given a fixed partial denture to this particular patient, she did not allow any of the instruments to get into her mouth. Intraoral acceptance of anything was not allowed by her. So we anyhow made an impression and fixed it with the removal partial denture. That was a interim partial denture with the help of wrought wire clasps, because it was the need of the child that he didn't want his mother to have a gap in between the teeth. That was his chief complaint. So fixed partial denture was not possible, so we came ahead with the removal partial denture. So the next indications can be for medically compromised people. Psychologically, patient is not prepared for a permanent denture, or transition to a complete denture where teeth needs to be extracted but not immediately. In those cases also we will keep it like class 3 mobility, but the patient do not want an extraction right now. So in those cases again we will going with interim partial dentures. Treatment dentures like improve the condition before a definitive prosthesis. If the healing of that particular region is not complete, so in those cases also we will use a interim prosthesis or a treatment partial denture. Some patients, for example, we will use it as a surgical splints, like for example, that is, or also to determine how the patient will react to temporomandibular joint disorder. This patient had a severe temporomandibular joint disorder with heavy clicking and crepitus sounds present. When we had examination of this patient, we found that the occlusal discrepancies were the cause for it. So we removed the occlusal discrepancy, and for deprogramming, we had to give this occlusal splint. There's a hard splint. So in those cases also we will be going ahead to react to the TMDs, so that that will act as a temporary denture, temporary acrylic partial denture, like a splint. It can be used as a surgical splint also. See this case where we are using it, the palate from here, there was a big tori which was removed. That tori, when it was removed, had to be supported with something so that the healing was enhanced and bleeding was also less. So this is just post-surgical picture where we are using, with the help of Adam's clasp here onto the molars, we have given this treatment partial denture for 15 days for the healing and betterment of the particular patient. So the bleeding was also into control, as well as the healing period was also decreased in these kind of patients. So that was another important thing. So implant healing is also another way where treatment partial dentures can be given. So implant healing which has not taken place, or tissue conditioning. Another important thing is the patients who have got hypoplastic tissues, or there is abuse in the tissues, mucosa. In those patients we can apply tissue conditioners, or we can apply a reliner material and give a treatment partial denture. So these are. Another important thing was alteration in the vertical dimension of occlusion. In some patients where the vertical dimension of occlusion is to be altered, now we do not want to lose that vertical dimension. So what we will give is the removal partial denture when the teeth is already present. So when the teeth is removed, when the extraction is done, our treatment partial denture will determine our vertical dimension at occlusion. So that is another advantage which we can find out from a interim prosthesis. Now, what are the steps that has to be followed for fabrication of interim prosthesis? That is, the first initial is primary impression. As we all know, we have to design the definitive prosthesis. Tooth preparation for the definitive RPD is required if required. For example, unfavorable undercut that has to be removed. If you want to, give away a tooth a little bit of rest, that you can give away. Occlusal discrepancies can be removed. Then you have to make the maxillomandibular relationship and articulate the casts. Now the clasp that you have to make is with the wrought clasp wire, that is 0.02 inches. That is the used in orthodontics. Now bracing has to be again with the lingual or palatal major connector. That will provide bracing effect, and that has to be rigid. The contact teeth should be at the height of the contour of the adjacent teeth which is present. Now, like for example this one, it is a flexible interim prosthesis for the patient who had class 3 mobility in these teeth which is there, should have been come here, and class 3 mobility was present. So for in those cases, we are supposed to use another treatment partial dentures for the time being. What are flippers, or also called gum flippers? This kind of interim partial denture, or the treatment partial dentures, are also termed as gum flippers. That is something which is flipping over this particular gum, which is resting over the gum. It doesn't have any abutment, it doesn't have any clasp, it is just resting over the gum. So these are called gum flippers as well. At times we do not give any buccal acrylic plate. We avoid giving any buccal acrylic plate. So those are called gum strippers. This is flipper, and those are called gum strippers if we are not giving any buccal acrylic plate. These are all different kinds of interim prosthetic or interim removal partial dentures or treatment partial denture, transitional dentures. Different names are attributed to this kind of treatment planning. Before going ahead with a fixed prosthesis, fixed diagnostic and fixed treatment planning, we can of course give this till the waiting period of our final restoration. Thank you.